Can you afford to survive critical illness? Be covered with Momentum. Around 1 in 3 people develop cancer during their lives, with most newly diagnosed cancers being in people over 60. But the disease affects young and old, and getting a diagnosis when you're young can have all kinds of unexpected costs, both medical and personal.
My story starts at the age of 21 when I was actually diagnosed with brain cancer, and after 7 years of wrongly being diagnosed, I had to sit in front of a doctor and hear the words, "You have cancer." And within a week I was diagnosed, and then I had the operation. I had to go for a lot of brain scans, firstly the CT scans, then the MRI scans, a lot of blood tests. Then I had the operation. I then had radiation therapy. I did have a medical aid. I was on my fiance's medical aid on that stage. So that really, really helped me. Unfortunately, I did reach a cap not long after the operation. The hospital was paid in full, but other things like the scans and medication was not covered then. And that had to be paid out of my pocket. It's not like going for an X-ray. It's really, really, really expensive. And that is one of the costs that I would never have thought of when taking out a medical aid.
An MRI costs around 10 to 12,000 rand, and while Magda could handle the financial debt, she found that there were some personal costs she had to deal with after the successful operation to remove her brain tumor.
I could not work after the operation, or the people around me, I forgot their faces. And coping with that was terrible. And then from there on, it went better, because at least I recognized my mother's face.
Magda lost some of her hair from the cancer treatment, but she decided not to wear a wig as she didn't feel the need to hide her condition. Her positive attitude has helped her cope with the physical changes she experienced after the operation.
A lot of the muscles in my eye or the surrounding area was damaged. So I have problems with depth and distance perception. Stairs, they just freak me out completely. One of the obstacles that I did have throughout the struggle with the cancer was the fact that I had to change jobs. I had to actually be off work for quite a while, but medical expenses actually forced me to go back earlier.
Magda had cancer 13 years ago, and despite the physical and personal costs of the disease, she's found that sharing her story is helping others to understand the full impact the disease can have.
I got the call from the Cancer Association saying that, "Congratulations, you are new Global Hero of Hope." So things do happen for a reason, and me moving to Rustenburg, it was just the beginning of such a lot of different things. With regards to medical aid, I had to make a decision. Me and my husband actually decided, I do have a history, let's stay on a medical aid. Unfortunately, we took him off, and now we're actually in a bit of a sticky situation with that. Due to his health. People look at medical aids, you need hospitalization, and that's about it. In my case, it was the extras, the medications, the out-of-hospital expenses that was the problem.
If diagnosed early enough, many cancers can be successfully treated, and a positive attitude has been proven to help survivors cope better with the disease and all the costs that may come with it.
I see myself as a cancer survivor. I'm not a victim of cancer. Every single day I live to the fullest. I must say, before the operation and before the cancer, I was a very, very shy person. Yeah. But today, due to the motivational talks that I do, the cancer Relay for Life events that I do, it's just the best thing since sliced bread. I can share my story with everybody, seeing the people's faces when I share my story, and I can see the hope in their eyes. I can feel that I'm making a difference.
Can you afford to survive critical illness? Be covered with Momentum.